Hello and welcome to Cure Connections. I'm Dr. Shubham Pant, and I'm here today with Carolyn Choate, a breast cancer survivor of more than 14 years. Carolyn is joining us today after kayaking 300 miles with her daughter in honor of the woman she credits with saving her life. She is here to share her journey in hopes of inspiring others to never give up. Welcome to Cure Connections, Carolyn.
Thank you for having me.
Carolyn, you have a fascinating story, but let's start from the diagnosis. Tell me, you were diagnosed almost 14 years back. How did you get to the diagnosis? How were you diagnosed with breast cancer?
Well, it was an unusual diagnosis in as much as I had been religious about mammograms from the age of 40. And at 45, actually at 44, I had had a mammogram around Thanksgiving. They said,
around this time, around Thanksgiving.
Around Thanksgiving, they said, "You're fine, see you next year." And then in February, I began to notice something wrong, something different, something atypical around my areola of my right breast.
So something changed from before. You were looking at it and something changed from before.
Something changed. It was itchy. It became thick and leathery. It showed, it was like small capillaries began to appear. And I knew it wasn't right. So I went back to my primary, then to a specialist, and they said, "We'll give you another mammogram."
So primary care specialist, and then you went to a radiologist, the ones who do mammograms?
And they gave me another mammogram, and they said, "We see nothing. We'll give you an ultrasound. We see nothing." And I said, "I'm telling you, something's not right."
And you knew your own body. You said there's been definitely
Exactly.
changes which are happening.
I said, "Something is not right." And finally they said, "We're going to give you a punch biopsy on your areola." And then I was called into the office, and they said, "Carolyn, you were right, and you're going to be back here in 1 week for a radical mastectomy. We found severe traces of cancer. However, don't become overly concerned as far as progression of the disease, because we're quite sure that it's localized."
Localized means it's only in the breast, hasn't spread out. Carolyn, you know, a lot of people have these experiences. Where were you when you first heard that you have cancer, when the C word was mentioned to you? I mean, what kind of feelings? Were you in your primary care's office when it was said? Were you called into the office? What kind of feelings went through you? How was it, broken down to you? You think, sometimes, physicians, we're learning all the time, learning on maybe how to do a better job in kind of talking to patients about diagnosis, about treatment, so patients understand it. And so just tell me a little bit about your experience, about when you were diagnosed, how it was said, what did you understand the first day? How do you wish, what else would you have liked to hear that day?
Well, I think initially I felt vindicated. I felt that had I not advocated for myself, the question is, what did you learn from the experience? And I think, as you point out, I would like to flip that around. What could we all learn from the experience? What could medical professionals learn from the experience? What could a patient learn from listening to this experience? And you must advocate for yourself. And secondly, again, I felt vindicated because, one, if you don't know yourself, you should, because, and I mean that in a bodily sense, that those regular self-exams, they matter. It's not the fact that you'll find anything perhaps ever in your life. What happens is, over time of knowing yourself, someday you might.
You might, exactly, and you did.
And therefore, when the time comes, you have the evidence, even if it's not a medical test, you have evidence in your mind to fight, for yourself. But I'll get back to the point of them saying to me later in that office, "Don't become overly alarmed because of this diagnosis, because we know that it's, we feel strongly that it's localized." Guess what?
It was not localized.
It wasn't.
And we'll come to that. No, you think they could have just said, "Hey, this is cancer. Let's see, how it comes. What happens with the surgery. We're going to do a surgery."
Well, they did tell me in the post-operative. They did tell me in the post-operative meeting, because I did have the sentinel node dissection. they didn't know until after the mastectomy that in fact it was. And I actually felt sorry for the surgeon because she was someone I had known for a long time and someone who I think there was no one more surprised than she to actually find out that it was not localized after all the tests I had been through. So after that point, in realizing that, yes, in fact, it was in 4 lymph nodes, actually, as I recall that day, I was numb. And you hear that frequently, probably from patients.
That's right.
I actually had that experience where probably my consciousness rose out of my body and floated up to the corner of the room and looked at that woman sitting in a chair and just thought, what's to become of her?
Did you think about, did you have your family members with you there? Do you recommend, family members go when such a diagnosis is, or there's something going on? Did you get a phone call saying come back in?
Okay. My husband is my rock, and my husband is 20 years older than me. So in the scheme of life and having 2 young daughters at the time, 45 with a 9-year-old and a 12-year-old, it doesn't take a rocket scientist to imagine that perhaps that he would be the first to pass and that I would be, the younger woman with the 2 children. And now all of a sudden the universe is upside down. This is going to be, perhaps my husband to raise our 2 beautiful daughters. And that was the biggest shock that, it was a realization that in this life you can't count on anything really. And from that moment on, I knew that, people do and don't like the terms of fighting cancer.
Right.
But I knew that if anyone could, that I was of such a spirit and such an attitude that I knew that I would do my level best.
And now we know that you did, and you keep on doing it every day.